Have you ever looked in the mirror and noticed these rough, brown, stuck-on, warty growths? Maybe it's on your chest, your back, your face. You ask your doctor about it, and you're told it's harmless. Or maybe, if it bothers you, we can freeze it off. And that's usually where the conversation ends. No creams, no medications, no alternatives. Just learn to live with it. If you're over 40, chances are you've noticed more of these appearing over the years. And if you're frustrated because nobody seems to offer another option, you're definitely not alone. But what if I told you there's a treatment that most people have never heard of? One that has actually been studied in clinical trials. A treatment you may already have seen sitting on a pharmacy shelf. Now, before you get too excited, I'm not talking about a miracle cure. I'm not talking about one of those internet remedies involving apple cider vinegar, toothpaste, or baking soda. I'm talking about actual medical research. And today, I'll show you exactly what that research found, who it might help, who should absolutely not use it, and why it's something worth discussing with your dermatologist. By the end of this video, you'll know far more about seborrheic keratoses than most people ever do. Let's begin. First, let's make sure we're talking about the same thing. Seborrheic keratoses are one of the most common skin growths I see in clinic. In fact, if you're over 50, there's a good chance you already have at least one. Some people develop dozens, others develop hundreds. They usually look like little waxy or rough patches that appear to be stuck onto the skin, almost as if someone glued them there. They can be tan, brown, dark brown, even almost black. Some are perfectly flat, others become thick and wart-like. They're commonly found on the chest, back, neck, and face. And although they're completely benign, they can be incredibly annoying. Patients tell me all the time, they catch on my necklace, they bleed when I shave, my bra keeps rubbing on them. People think they're skin cancer. I hate how they look. So while doctors often call them harmless, that doesn't mean they don't affect quality of life. And that's where the frustration begins. Because once people hear they're harmless, they're often left believing nothing else can be done. But before we talk about treatment, there's one incredibly important point. Not every brown raised spot is a seborrheic keratosis, and this is where people get themselves into trouble. Certain skin cancers, especially melanoma, can sometimes resemble a seborrheic keratosis. So here's the rule I give all my patients. Never treat a skin lesion at home unless you're confident of the diagnosis. Or even better, it's been confirmed by a healthcare professional. If it's changing, growing, bleeding, ulcerating, developing multiple colors, or simply looks different from all your other spots, don't experiment. Get it examined first. That advice alone could save your life. Now, let's talk about the treatment that surprised many dermatologists. Believe it or not, it's actually a medication originally designed for something completely different, diclofenac. Most people know diclofenac as a pain-relieving anti-inflammatory gel. People use it for sore knees, back pain, sports injuries, arthritis. So how on earth did researchers end up testing it on seborrheic keratoses? The answer is actually fascinating. Scientists already knew that a prescription-strength diclofenac gel is effective for treating actinic keratoses, those rough, sun-damaged spots that have the potential to become skin cancer. Since both actinic keratoses and seborrheic keratoses involve abnormal growth of skin cells, researchers began asking an interesting question. Could the same medication help with both? That simple question led to several clinical studies. Now, let's look at what they found. The first report involved a single patient, one facial seborrheic keratosis. After regular application of 3% diclofenac gel, the lesion completely disappeared. Now, one patient doesn't prove anything. Medicine never works that way, but it gave researchers enough reason to investigate further. Next came a study involving multiple patients, where researchers compared diclofenac gel with another anti-inflammatory medication. Interestingly, only the diclofenac-treated lesions showed meaningful improvement. That suggested the benefit wasn't simply because inflammation was being reduced. There appeared to be something unique about diclofenac itself. Then came the study that really caught attention. Patients applied diclofenac gel twice daily for several weeks. By the end of treatment, a large proportion were rated as completely clear or almost completely clear. Meanwhile, those using placebo gel showed virtually no meaningful improvement. Whenever I read studies, I always ask one question. Could this just be chance? In this case, multiple studies pointed in the same direction. That's encouraging. But we also have to be honest about the limitations. These weren't huge international trials involving thousands of patients. The studies were relatively small. We still don't know which patients respond best. We don't know whether certain body areas respond better than others, and we don't know exactly how durable the results are over many years. That's why I don't think it's appropriate to call this a breakthrough, but I do think it's reasonable to call it promising. And in medicine, promising evidence is often enough to begin having informed conversations with patients. So who might consider discussing this option with their dermatologist? Perhaps someone with multiple seborrheic keratoses, someone who isn't a good candidate for freezing, someone who scars easily, or someone with many lesions, where treating each one individually would be expensive or impractical. On the other hand, if you have just one or two bothersome lesions, cryotherapy, curettage, or shave removal may still be faster and more predictable. There's no one-size-fits-all answer. Treatment should always be individualized. Another question I know many of you are wondering: can you just buy Voltaren gel from the pharmacy and try it yourself? Here's where things become a little more complicated. Most of the stronger evidence comes from studies using prescription strength 3% diclofenac gel. That's not the same as the lower strength over-the-counter products available in many countries. While a few smaller studies suggest lower strengths may have some effect, the evidence simply isn't as strong. So I wouldn't recommend self-treating without first discussing it with your dermatologist. You may also have heard that hydrogen peroxide can remove seborrheic keratoses. There's some truth to that, but with an important catch. A 40% stabilized hydrogen peroxide solution has been studied and approved in some countries for treating raised seborrheic keratoses, with clinical trials showing good clearance in many patients. However, this is not the same as the 3% hydrogen peroxide sold over the counter for cleaning wounds. The weaker version has no good quality evidence for treating seborrheic keratoses and shouldn't be used as a DIY treatment. As always, make sure the diagnosis is confirmed before treating any skin lesion. Remember, the biggest risk isn't the gel itself. The biggest risk is treating the wrong diagnosis. That's why confirmation comes first, treatment comes second. I also want to address something I see all over social media: apple cider vinegar, tea tree oil, hydrogen peroxide, toothpaste, banana peel. I've seen every one of these recommended online. Unfortunately, most have little or no good quality scientific evidence. What they do have is the ability to irritate your skin, cause burns, create infections, or delay diagnosis of something much more serious. Personally, I'd rather rely on published clinical studies than viral internet hacks. Medicine isn't about chasing miracles, it's about following evidence wherever it leads. So what should you take away from today's video? First, seborrheic keratoses are extremely common and completely benign. Second, always make sure the diagnosis is correct before treating any skin lesion. Third, emerging evidence suggests diclofenac gel may help reduce or even clear some seborrheic keratoses, but the evidence is still developing and isn't strong enough to replace standard treatments in every patient. And finally, if these growths bother you, don't assume you have no options. Have a conversation with your dermatologist. Ask about the evidence. Ask what treatment makes the most sense for your particular case, because the best treatment isn't always the newest one. It's the one that's safest, most effective, and right for you. If you found today's video helpful, you'll probably enjoy my next video. I'll see you in the next video.